What's up, everybody? My name's Mr. Christian Elijah, and I'm just another guy who happens to be trans. So today's video is going to be on the physical changes to expect while taking testosterone. So let's get to it. Now, I got this information from personal experiences that I know my trans guys have gone through, and also research. And there's two pretty credible sources that I am getting this information from that validates basically what I've been thinking. I'm going to add the info cards right here, and then you can click on these and be taken to those sites. Okay, now really, let's get to it. So one of the physical changes to expect is that your skin's going to get thicker, your pores are going to get bigger, and there's going to be more oil production. So welcome to your second puberty in the wonderful world of acne. Another thing to expect is your odors are going to change, your sweat's going to change, and the way your pee's going to actually change. The pee, not your pee, sorry, but the way your pee smells is going to actually change. I thought when I first started testosterone that it was the weirdest thing. When I went to the bathroom, the odor was a lot stronger. So unfortunately, guys are grosser and we smell more, and we don't even actually have to do anything to, smell bad. When I was growing up and was living as a female, I played sports, and I didn't like my body, so I didn't like taking showers. And so I could go, a few days to a week playing sports and not showering, and I didn't smell horrible. Now today I will just be standing there or take my dog on a walk and I start smelling bad. I wear an undershirt and a regular shirt because I just sweat all the time. I sweat on my back. I sweat obviously in my armpits. And the way I break out is, on my shoulders and my back. And so, I take, 1 to 2 showers a day so that I don't break out as much. And I have a better skincare routine, which can also help. And you can talk to your provider about that. Another physical change to expect is the redistribution of your weight. So fat to be from shifting from your thighs and your hips, and you may gain weight in your stomach. Now, all of this also depends on your genetics, what weight you were to start with. If you were a lighter brother or a heavier person, for the non-binary people. But also it also depends on how much you're eating, what you're eating, if you're working out, if you're not working out, because you're also going to get stronger. I just was naturally stronger. Now, if you want to get buff and you want to look like the Hulk, you're going to have to work out and you're going to have to eat right. But you are going to get stronger naturally. You're also going to get more definition in your arms and your thighs, and your veins. Your veins are going to start popping out of your arms because your skin gets thinner on your arms. So it's another physical change to expect. Now, for those who want to have top surgery, fortunately or unfortunately, your chest really is not going to change much besides the redistribution of fat. So I was a bigger chested guy, and you know, because of the redistribution of fat, this is what I'm going to share is not really a fun, pretty thing to think about, but it is what it is. It is what it is, and it's just part of transitioning. So because of the redistribution of fat, I was a bigger chested guy, and I did bind and everything like that. So what ended up happening was that I just basically started looking like as if I had a really big chest, and I lost a lot of weight, and there's just skin hanging there. But one thing Dr. Maddie, with my research, Dr. Maddie said, and other surgeons have also said that, is that you should wait at least 6 to 12 months before you have top surgery because of, and I'm going to quote what the article says. It says, um, your your chest won't change much. Surgeon recommends 6 to 12 months before top surgery in order to allow contours of the muscle and the soft tissues and chest walls to settle in their new pattern. Now, because I worked out, I didn't get top surgery until I was about 4 years on testosterone because I didn't have the cash for it and it wasn't covered by insurance. So I worked out over a year prior to my top surgery. And the benefit of that was that my muscle definition was so well defined that my top surgery was, my surgeon said it was so easy because all the muscles and everything, she knew exactly where to put everything. She knew where to place the nipples. And no matter how much weight I gain or lose, I'm always going to have pectoral muscles. So if you want to have really good results for your top surgery, be patient and just, work out for at least a year. Let your body absorb the changes of the testosterone because puberty, like I said earlier, puberty takes time for cisgender guys just like transgender guys. One thing to look forward to is your face changing. Now, your face is going to become more angular, and since there's going to be a shifting and fat decrease in your face. Now, your bone structure is not really going to change depending on what age you started transitioning. according to the article, it says that if you that people may see actual bone structure change if they transition within their in their early teens to their early 20s. So that's the benefit of transitioning earlier than later. But you figure out who you are and you transition when the time is right for you. For me, like there was a time when I was on testosterone where I didn't feel like a boy or a girl. I felt like I was an it. It was very, my face was very dysphoric actually because I didn't, I didn't understand. Like I actually never heard people talk about like the in between stages of what my face was going to look like from going very feminine to more masculine. My jaw's a lot squarer, and I have these little I don't know what you would call these, but these divots, and I love them. It makes me feel like looking more masculine. But prior to that, I just felt like I was in an in between stage of gender. So if that happens to you, don't freak out. It is going to change. Your face is going to, start looking more angular, and you'll start looking more male. I've been on testosterone over 10 years and it's going to be okay. Another cool thing is when your voice starts to drop. So most people, well, not most people, but a lot of people will start experiencing vocal changes in their voice deepening or their voice at least changing within the first few weeks of starting testosterone. Now, everybody will, their voice will get deeper depending on who they are. And also, if your voice is not dropping as low as you were hoping you could, sometimes I feel like my voice is too feminine even still, and so I do I went to Kaiser and got some vocal speech therapy. Another thing is that because of that, your vocal cords will be thickening, which actually is the reason why your voice changes. And sometimes I talked like this when I was first transitioning, and I felt like I had a sore throat all the time, but I didn't, and felt like really hoarse. But yeah, so one of the benefits of starting testosterone pretty slow is that you'll have a more natural sounding voice based on everything that I've learned. So remember, take this easy. Oh, excuse me. Take this easy, take it slow. So let's talk about the last physical change. I'm going to do, when it comes to the lower regions, I'm going to do that in another video. So the last thing we're going to talk about is hair growth. So one thing I always wanted to have was facial hair. And so this was something that I was really excited about when I started testosterone. Unfortunately, it took me about 7 years to actually grow a beard. And according to the research, it takes about 5 years for your growth to actually, really come into fruition. Now, guys you're going to get hair growth based on like what's similar to your genetics to your family. So a lot of guys will get more hair on their arms and on their thighs and on their butt and stuff like that. I really didn't get that. I got some on my thighs and I got some on the back of my thighs, but it's really not that thick. The hair on my arms is really not that thick, but I do have chest hair and I do have stomach hair. And I also started thinning at the top, and I'm taking finasteride, which is actually a testosterone blocker, um, to fight that. But it's like I said, it's going to take time. It takes about 5 years. Depending on your race and ethnicity and genetics, some people get a full beard within a year. My genetics is not very hairy, and it's taken me 7 years to get this. But your hair's going to grow in darker, and it's going to grow in faster. So that's another thing to look forward to. The last thing I wanted to say regarding this whole thing is I just want to put a disclaimer in. Now, everything is also always going to be dependent on who you are, what you look like, what age you are, testosterone. And these are just my experiences and based on the research. Now, everybody's always going to be a little bit different. Some people, don't have the same experience. It took them a lot longer to grow, full head of hair. Or full beard, excuse me. And some people aren't going bald yet. I've been transitioning over 10 years and I'm starting to go bald. Everybody's different. So take that into consideration. I'm not trying to be offensive to anybody. This is just based on my experience. If you have any questions or concerns, or think I left anything out, or want me to research a topic and share my experience on what it's like, for somebody who's been transitioning as long as I have, let me know. Drop a comment below. This is very new for me, and I'm really hoping to bring some good information to the community. So thank you and have a wonderful day. Stay safe out there.